I'm Dr. Roxanne Guy, and I'm a plastic surgeon here in Melbourne, Florida. And I like to talk about credentials because I think they're extremely important. There are many people now that want to try to be a plastic surgeon, and many of them are not credentialed. You wouldn't want your neurosurgeon to take a weekend course and then, crack your skull or something like that. So I would advise people to be just as careful in choosing their plastic surgeon. In fact, plastic surgeons need to train at least 6 years after medical school, and usually 7 years after medical school, to become a plastic surgeon. And in fact, that's about how many years it takes to become a neurosurgeon as well. So it's important that you have someone who is such trained. They need to have learned about sound surgical principles, so they need to have had surgery. They need to learn about how to take care of patients pre and post-operatively. They need to learn about safety, patient safety, what to do if there are any complications, and just the overall health of the individual, not just that one specific thing that they're working on. So how can you know if that's really happened? Well, board certification is one thing, but unfortunately right now there are so many bogus boards out there. Everybody's calling themselves board certified, and they may not truly be board certified. So you want to look for board certified by the American Board of Medical Specialties. That's the oldest medical specialty foundation in the United States, and in that is the American Board of Plastic Surgery. That means that you've passed your board exams, you've taken strict oral examinations and written examinations, you've had to pass ethical tests, you've had to practice in your community for a couple of years without any problems, and that you have other people in your community who will vouch for your abilities. Also look for, is the person a member of the American Society of Plastic Surgeons? If they are, number one, they have to be board certified. Number two, they have to have sworn to specific ethical standards. They must operate in an accredited operative center, and they must have privileges at a hospital. If you have privileges at a hospital, that means you've had to have been vetted and looked at in terms of what your credentials are. Don't just go to somebody who's had a weekend course in this or a weekend course in that and they have the cheapest rate, because honestly in plastic surgery it's not like going out and buying a pair of shoes. Sometimes you get what you pay for.